We ran in the news, I think it was this week or perhaps late last week, where an SMS service has been launched by the Department of Health, where women will be getting SMSs to remind them about their childcare, inoculations, just things that they should be doing to look after their children. Well, Ayanda's got more for us on this initiative. She's at the KT Motubatse clinic in Soshanguve, as I say. So let's find out how this is all going to be working. Ayanda's got the details for us. Ayanda, good morning to you.
Dumela Leanne, rale dumedisa bommele bontate mo gae. A very good morning to you and welcome, as Leanne has mentioned, to the KT Motubatse clinic in Soshanguve Extension 4. Yes, Leanne, we're here for the Health Department's launch of the MomConnect initiative. It is a SMS cell phone service that will be sending out programmed and personalized messages that will be beneficial and helpful to every mom, right from conception to giving birth. It's connected to the Millennium Development Goals 4 and 5. Number 4, of course, dealing with curbing by 2/3 the child mortality rate, and of course the Millennium Development Goal number 5 dealing with maternal mortality rates, trying to reduce that by 3/4. So let's speak to the brains behind MomConnect and also one of the beneficiaries. I have Dr. Jürgen Pillay. He's the Deputy Director General responsible for MomConnect, and we also have Veronica Namango. She's one of the patients here who've benefited from this project. A very good morning to the both of you.
Good morning, Ayanda.
Doctor, let me start with you and ask you exactly how is this initiative going to work?
Firstly, Ayanda, let me say that the brains behind this was the Minister of Health, who 18 months ago asked us to fulfill a dream of his, which was to have personal contact through cell phones with all 1.2 million women in South Africa who fall pregnant annually. So we've been working quite hard in the department to try and fulfill the Minister's dream. The idea is that we will help at clinics and in the communities pregnant women to register using their cell phones, and they will get messages appropriate to each stage of their pregnancy as the pregnancy progresses. Once they deliver, for 1 year afterwards, to look after the baby, they will get messages about how to ensure that the baby is healthy.
It's a huge logistical task. How exactly do you plan on implementing it on the ground?
Well, we've started already. So we've trained more than 10,000 health workers, both nurses, community health workers, and data capturers, to assist mums when they come to our clinics or when community health workers encounter them in communities to register. But it's a very simple task to register. It'll take about 2 or 3 minutes to register. And once registered, and Veronica will explain how she registered, they will get messages almost weekly from us. They can also complain, as the Minister will explain later.
I was about to ask, can they complain about the nurses, about some of the services? So it's not just a one-way communication, it's a two-way stream?
Absolutely. It's interactive through text messages, so they can send us compliments if they receive good quality care, and they can send us complaints and concerns that they have. They can also ask us questions that we didn't answer in our SMSs to them.
Veronica, you've tried the service, I think, for the past 2 weeks now. How have you found it?
Yeah, it's very interesting and I'm much interested on it, and it really helped a lot. I've got 2 free SMSs each and every week, and then I can SMS them for any service that I've got from the clinic, and then I can also SMS them if there is something that is bothering me at home. Maybe there is some signs that I don't understand, and then they will reply back to tell me that if it's a danger sign, so that I can go to my nearest clinic, and then if it's not a danger sign, they will let me know that what to do. And then it's much interested about MomConnect. And if you want to come and register for MomConnect, you have to come to the clinic and book first, and then after you go to register, it's for free. Yeah, the thing is, it's for free. It's much interesting.
I'm so glad you're getting the help that you need. I know how daunting it can be to be a mom when you're trying to find out what's normal and what's not in the various stages of development of baby. But doctor, before we end off, Veronica says it's for free, but we know having to deal with data capturing and managing the system and the softwares and the manpower is quite a big job. Who's footing the bill?
Well, at the moment, we have donors who have kindly donated some funding to us, and we have also some technical expertise that's been made available to us. So at the moment it's not costing the department anything, at least for the next 2 years. So the development costs and the operating costs for the next 2 years will be covered by our donors. We will announce who they are later when the program is finally launched by the Minister. Thank you.
Thank you so much to the both of you. We'll have to leave it there for time purposes. But Leanne, very interesting. We will be speaking to the Minister himself a little bit later, speaking holistically now with regards to South Africa and where we are in terms of achieving the Millennium Development Goals. This particular initiative, I think, will be quite popular among teenagers who do form the majority of maternal mortality incidents in the country. 36% of those who die during childbirth or childbirth-related instances are your teens. So the more information they can get, the better, I think. We'll divulge more information and details with the Minister in just a moment. Back to you in studio.